with that chart. We didn't stop having kids that are becoming of age and becoming of working age, which would be paying into Medicare, Medicaid, Social Security.
This has to do with the percentage of the population. This is all relative numbers. Let me show you the next chart. You'll see.
So are we still having 2.1 children?
I don't know what you have, but I've got two even.
Only because
Don't forget to teach our younger generation what to do.
This is what I was getting at earlier.
Reporting them now.
If you just cut earmarks and foreign aid, that's what you cut. And we've already banned earmarks, as you know. Just to give it some perspective.
Still a good.
Why Social Security is growing so fast? Americans are living longer. More seniors are receiving benefits than ever before. Birth rates are not keeping pace with retirement.
May I ask you a question regarding
Yes, sir.
that? Recently, the oil companies were taken to court, or your court, government, and they said there's so much, well, Congress, said there's so much billions of dollars, and you guys, I assume the Republicans want to put it against the debt, and the Democrats want to put it into green power. That's great, and I think it's time that the oil companies belly up. Why, in this Medicare situation, are the pills that we get costing $180 a bottle for pills established? Can I buy it for $180 in Little Rock, Arkansas, or I could go across the border to Mexico, which is the same cotton picking pills out of the same sealed bottle, for $8 and some cents? Why are we being raped by these people who are holding us against the fire? Can't you come in there and say, knock it off?
Well,
No, they could.
couple
employ
things.
they could
One,
employ unions.
we definitely have to deal with the pricing, or what we are paying for drugs. But let me tell you a big part of the problem. A big part of the problem is that we
Regulations.
pay, American
Bureaucrats.
companies pay for a huge amount of the research and development that get us these awesome drugs. And then these other companies, they don't pay for any of that R&D, and they're just able to manufacture. And some of them manufacture legally after they are legally able to copy it, make generics.
Generics.
And some of them are not able to copy them legally, and they do it anyway. But
I understand R&D. I really do. Well, I think I do. But
you can explain it to me.
after a certain point, in northwest Arkansas, there is a plant, I used to call them, out in the country, making thousands of pills a day for one of the pharmaceutical companies. They're using labor out of northwest Arkansas, so that either means some poor Mexican or some poor white guy couldn't get into the chicken factory. One or the other. And they're pouring out these pills. I don't know what's costing $180 a bottle for. See, these are the things that really knock us. There's a gentleman in this room who is not going to be able to get his pacemaker in 4.5 years. His doctor already told him, die or come up with the money. And he's sitting back there. I'm sitting back there somewhere.
Where is it?
Stand up, Bill. Bill, where are you? He doesn't have a pacemaker in 4.5 years. That's criminal.
Now, who said he's not going to
His
get one?
doctor.
The doctor said that.
Why, how does the doctor?
He says that age, cost, not effective.
Get another doctor.
Well, yeah, I mean,
death panel, but that's.
I'll be happy
Death
to,
panel.
Carl, get his information, be happy to help him, but I don't,
I didn't know we were.
I'm not a doctor, but that doesn't sound right to me, but, you know.
But we have czars that Obama sends out to GMC, and czars he sends out to, and I don't even know what czar is in the Constitution. But he sends these people out to control things. Isn't that Medicare problem in reality a drug problem, a doctor problem?
Fraud problem, an illegal alien problem.
It is.
What is the cost in there?
Bureaucrats running a
Well,
problem.
it is, I mean, all of those things go into the cost. I think the big problem is, a big part of the healthcare problem is the current Medicare system encourages cost inflation. And what we're trying to do is bring some market forces into it, into the system. And that's a big part of our budget. Look, I'll tell you this, if there's anything specific, if you know of a specific drug that you're wondering why it costs so much, if you give me the information, I'll ask the drug companies that make it to explain to me why it costs so much.
He will.
I'm happy to do it,
He will.
but not tonight. But, but here's a big part of our issue with Social Security. And Social Security is easier to deal with than Medicare in terms of fixing it long term. It's got a few more years. 16 and a half people working for every one Social Security recipient in 1950.
We were supposed to, wasn't our longevity like 61 back then or something?
Yep, look at that, well, 68.
Okay, 68.
That's a big
Yeah.
issue. It's a big issue. It's not that anyone ran off with your money.